The CDC says people who test positive for COVID should still isolate for 5 days. The Washington Post had reported that the CDC was considering easing COVID isolation's restrictions soon. But that's what we're going to talk about today. Here to join us is Dr. Bill Hartman, clinical trialist at UW Health. Hi, Dr. Hartman. So thrilled you to be here today. We got a lot to get to. So the notion is you're test positive for COVID, and because this is so catchy, if you will, so transmittable, you hunker down and you stay away from people. Why is this up for debate now?
Well, the CDC is trying to find public health measures that the public will actually follow. And there's been a lot of people who have been reluctant to do isolation because they can't miss work or the kids can't miss school. And so they haven't been testing and they really haven't been following the 5 days of isolation with 5 days masking that the CDC currently recommends. And so they're looking for a pathway that's easier for people to make sense with. This one, if you're done with a fever without having to take medicine for 24 hours, then you're good to leave your house. Basically, though, with any of these, the RSV, influenza, COVID, if you are sick, stay home. Remember to keep your hands washed. You're going to have to still mask in certain places and at certain times, so know your surroundings. But all in all, this is supposed to be an easier guideline to follow, and hopefully people will follow it.
Okay, so yeah, what you're saying is people are kind of doing their own thing. So they're looking at if you're fever-free after 24 hours, you can get out and about. Again, they're still not standing by that, but that sounds like it's there to come. So we'll keep an eye on that. The other one we want to get to is this antibiotic effective against uncomplicated UTIs. And for anybody who's ever had a UTI, you know it's debilitating. What is this new oral antibiotic?
Well, this is really exciting from GlaxoSmithKline. And they tested this in Europe in 2 different tests. And what they found is that this new class of antibiotics that attacks 2 different enzymes in DNA synthesis is as effective or even more effective in one of the studies than the current treatments for uncomplicated UTIs. And so, as you know, over time, bacteria, viruses, these things mutate, they change, and they become resistant to antibiotics. So having an entire new class really is going to be a game changer here, and it's going to save a lot of discomfort to a lot of people throughout the world.
Yeah, they're just terrible, of course. So this is really good news on the horizon. We do have time for this last one because these numbers, these statistics about smoking are astonishing. However, there's this new study out that says when smokers quit, their immune systems get better on one level, but not quite all the way. It seems a bit discouraging to stop smoking for people who just can't kick the habit. Like, what's the point? But any little progress is better. Talk about this new data here.
So what was seen is that, we know that smoking kills about 500,000 people a year here in the U.S., that it's associated with cardiac disease, that it's associated with lung cancers and several other cancers. Now they also know that it's associated with hurting your immune system and damaging it in 2 different places. If you quit smoking, the initial immune system that's found kind of in your mucosal membranes it comes back, and it does a pretty good job. But for infections that would be more complicated, that you need your B cells and T cells for, those remain damaged for quite some time. And so any smoking at any point is really bad in terms of your down the road immune system. So quitting it now will help you as you get older.
Yeah, the patch, any kind of counseling you can get, whatever it takes, the best thing is to just get off ASAP. Thank you so much for all your insight. Boy, we could spend a whole hour with you, but we got to wrap it up, unfortunately. Thank you, Dr. Hartman, for being with us.
Thank you.